Hi, I'm Dr. Saravanan, working as a lecturer in Faculty of Physiotherapy, Dr.M.G.R. Education and Research Institute. Today, we are going to see about mobility aids. The mobility aids are the aids which are used for mobility and the stability purpose. It is most used for the people who have difficulty in standing and walking, and the people who can't walk independently. So, types of mobility aids are crutches, walkers, canes, wheelchair, rollators, scooting boards. So now we are going to see about the crutches. The crutches are most useful for their non-weight bearing purpose in the lower extremities. So in this crutches we have three types. One is your axillary crutch, gutter crutch and the elbow crutch. Now we are going to see about the axillary crutch. The axillary crutch which provides more stability than the other crutches. So now we can see about the measurements of the axillary crutch. Now we are going to see about the axillary crutch measurement. We have two types of measurements. One is shoe off and next one is shoe on. Now we are going to demonstrate with the model. In lying position, we need to measure from the apex of the axilla to the medial malleoli of the in standing position, same as like that of the lying position. We need to measure that. So we need to measure from the apex of 5 inches below from the apex of the axilla, but away to the lateral aspect of your medial malleolus within 20 centimeters. In standing position, we need to measure from 2 inches below the axilla and 20 centimeter away from the lateral malleoli. Now we are going to see about the axillary gait crutch pattern. So we have three types. One is 2-point, 3-point and 4-point gait pattern. So now we are going to see about the 2-point gait pattern. We are going to see the parts of axillary crutches. One is, this is your axillary pad, this is your hand grip, this is your adjustable button for the length adjustment, and this is your rubber ferrule. In axillary crutch, we have already we have said that we have three types of gait pattern. One is 2-point, 3-point and 4-point. In 2-point and 3-point, we use only the non-weight bearing patterns. So now we are going to see about the 2-point gait pattern. In 2-point gait, we have two phases. One is your swing to and swing through. Now we are going to see the swing to phase. Ask the patient to keep both the crutches in a crutch line and move his unaffected leg within the crutch line. So this is a swing to portion. In swing through, ask the patient to keep both the crutches in a crutch line and ask the patient to move his unaffected leg away from the crutch line. This is a swing through motion. Now we are going to see about the 3-point gait pattern. So now ask the patient to keep your unaffected crutch, affected crutch and unaffected leg. We are going to see about the 4-point gait pattern. So now ask the patient to keep the affected crutch first, unaffected crutch, affected leg, unaffected leg. Now we are going to see the stair climbing technique using axillary crutch. So ask the patient to walk with a unaffected leg, affected leg and crutch, both crutch. Unaffected leg, affected leg, both crutch. This is the 3-point gait. In 3-point gait in stair climbing. Now we are going to see the 4-point gait. Ask the patient to keep the unaffected leg first, affected leg, affected crutch, unaffected crutch, unaffected leg, affected crutch, unaffected crutch. So this is the 4-point gait in axillary crutch using stair climbing. We are going to see the climb down stairs. So ask the patient to keep the unaffected and the affected crutch and affected leg. Again, ask the patient to keep both crutch and unaffected leg. This is the 3-point discrimination or 3-point gait. Now we are going to see the climb down stairs for 4-point gait. Ask the patient to keep the affected crutch, unaffected crutch, affected leg and unaffected leg. Affected crutch, unaffected crutch, affected leg and unaffected leg. We are going to see about the elbow crutch measurement. So in elbow crutch measurement, we need to measure from elbow to the medial malleoli. Okay. So 1 inch below 1.1 to 1.5 inch below the elbow and 20 centimeter away from the medial malleoli. This is with the shoe off. In shoe on, same as that of shoe off, we need to measure from the below 1.5 inch, below from the elbow and to the medial malleoli. This is the elbow crutch. This is mainly used for the adolescents. So we have parts in this. So this is your forearm cuff, same as this is your hand grip, and this is your adjustable button for length, and this is your rubber ferrule. And we have a pediatrics elbow crutches also, same as that of, this is the pediatric crutch, pediatric elbow crutch, same as that. We have a forearm cuff, hand grip, length adjustable, and the rubber ferrule. Now we are going to see about the elbow crutch. In this we have two gait patterns. One is your 2-point gait and 3-point gait. Now we are going to see the 2-point gait. So ask the patient to keep their affected leg and the affected crutch at the same time, and unaffected leg. So now 3-point gait, ask the patient to keep the affected crutch, affected leg, unaffected leg. Now we are going to see about the canes. The canes which are useful for the balance for the old age peoples and to improve the base of support. We have types of canes. One is the standard adjustable cane. Second one is a quadruped and the tripod canes. The parts of quadruped canes are hand grip, adjustable length, and the rubber ferrule. Now we are going to see about the walkers. These are the lightweight frames which has a 4 base support, and it is mainly used for the non-weight bearing, partial weight bearing, and it has a high base of support, and the COG falls within the frame. The types of walkers are rigid walker, reciprocal walker, foldable walker, and the walking rollators. We are going to see about the foldable walkers. So this is a foldable walkers which is a parts of hand grip, foldable button, adjustable button, and the rubber ferrule. So this is mainly used to non-weight bearing and the partial weight bearing. This gives the patients have more support. Now we are going to see the measurement of walker. The elbow should be at the level of 20 to 30 degree, and the length adjustment should be at the greater trochanter level of the femur. Now we can see the demonstration of your walker. So ask the patient to keep the walker first and unaffected leg. This is the non-weight bearing activity. Now we can see for the partial weight bearing, ask the patient to keep the walker first, then affected leg and unaffected leg. Now we are going to see the walking rollators. So the walking rollators, which is mainly used for the pediatrics and the geriatric persons, and it is mainly used for the geriatric persons for the purpose who cannot able to lift the walkers and walk. So the parts of the rollators are same as of the walking frames. It has the hand grip, then foldable button, then adjustable button, and the rubber ferrule. Next the rollator rotating wheel. Next we are going to see about the wheelchair. So this wheelchair is mainly useful for the patients who has both lower non-functioning and the partial functioning patients. Then it is mainly useful for the purpose of spinal cord injuries, brain injuries, quadriplegic patients, paraplegic patients, muscular dystrophies, then CP patients. Now we are going to see the parts of the wheelchair. This is the push hand, backrest, cushion, seat cushion, rest arm, push ring, caster, brake, calf strap, and the foot plate. Okay, now we came to the end of session. Now let's discuss about what we seen today. So what is mobility aids and what are the types of mobility aids, how to measure the aids, and how to use the mobility aids. Thank you.